Hard and fast, the tissues will tear. Slow and controlled, the tissues will stretch just enough to have your baby. Howdy hey, I'm Krisha, your natural birth trainer. Click subscribe to stay in the know about pregnancy and natural childbirth. The thought of tearing in your vaginal area to have a baby sounds terrible. It is feared by many women. Here are 7 tips on how to prevent tearing during childbirth. The number 1 tip to prevent tearing during childbirth is to birth your baby in the position you feel is best. It is the position you choose to put your body in at the moment your baby crosses your finish line. The birthing position someone tells you to get into or forces you to birth in increases your chances of tearing drastically. Laying on your back, knees wide, is the worst birthing position, yet it is very commonly used in hospital environments because that is how the medical staff are trained to deliver babies. This position does not allow your sacrum to move, creating space for baby to exit the pelvis. Plus, knees wide causes the sit bones of the pelvis to be closer together. This leads to a narrow pathway for baby to navigate, more forceful pushing by you, and not allowing the perineal tissues to stretch how they are supposed to. Women who are birthing naturally are smart and instinctual. They are getting in positions that allow the sacrum to move and open the bottom of the pelvis with internal rotation of the femurs. Your chosen position for birth greatly decreases your chances of tearing because you will create more space for baby to navigate your pathway and allow your perineal tissues to stretch how they're supposed to. Birth in the position you feel is best for you and baby, not how you are told to birth for someone else's convenience. You know how to birth your baby best. The next tip I want to clarify for those who are misled. Your uterus is a muscle. It contracts just like other muscles in the body when it's time to have a baby. For example, my bicep contracts, releases, contracts, releases. I'm doing that voluntarily. The uterus will contract involuntarily, meaning you have no control on when it will contract. It is programmed in your DNA for the birthing process to have as many contractions as needed to birth baby. The job of the uterus is to house the baby for 9 months, give or take a few days or weeks, and to evict the baby by contractions from the womb house when it's time. Leading into tip number 2. When you experience the fetal ejection reflex, meaning you cannot stop the baby from coming out of your body because the uterus is literally evicting the baby from the womb house, your uterus is involuntarily contracting baby out. All you need to do is control your breathing. In through your nose, sending your inhale down towards your baby, and exhale through your mouth, sending it down towards your baby. It looks like this. Down and out, low and loose. Yes, you need to breathe when your uterus is pushing your baby out of your body. Holding your breath and bearing down as hard as you can causes tearing. This is also known as purple face pushing, very commonly used in the hospital with epidurals because moms can't feel the uterus pushing baby out. When you breathe your baby out, the uterus will push baby out with the exact estimation of effort. No added forceful pushing significantly decreases your chances of tearing. When baby's head crowns, you may or may not feel the burning or the ring of fire, but definitely lots and lots of pressure. This is when you take quick, short breaths. Stay low and loose. Surrender to the overwhelmingly bear down urge of the uterus. Let your uterus do its job, and you as you ease your baby out, allowing the tissues to stretch. Your body will stretch just enough for your baby to be born. Tip number 3, you can ask your provider to hold a wet, warm compress to your perineum as your baby emerges from your body to help the tissues stretch. The perineum is the bottom of the vagina down to the anus. This area gets very stretchy with the high levels of relaxin hormone in your body. Relaxin hormone helps the joints and the tissues of the body expand, be stretchy during birth. Tip number 4, your provider can do a perineal massage of your tissues as baby's head descends to be born. The provider will use mineral oil, borage oil, olive oil, coconut oil, jojoba oil, to name a few, on your perineum as they use their fingers to massage in front of baby's head as it emerges during contractions. Tip number 5, eating proteins like animal organs during pregnancy helps with the integrity of the tissues of the body and reduces the chances of tearing. Vegetarians and vegans have a higher chance of tearing because of the integrity of the tissues. The tissues are more willing to tear than stretch because of the type of nutrition the body is receiving during pregnancy. Animal proteins help the tissues be more responsive in stretching and in recovery postpartum. I have noticed this with my private birthing athletes. The higher consistent animal proteins during pregnancy, the less tearing and healthier placentas. My vegan and vegetarian mamas unfortunately tear and need suturing afterwards. Tip number 6, birth in the water. Water helps the perineal tissues to stretch. Water also helps take the edge off the intensity of the contractions, allowing you more control. Birthing in the water also helps baby transition from water environment to water environment before breathing earthside oxygen. Tip number 7, save the best for last. Sex. A penis in the vagina helps prepare the vaginal walls and perineum for birth the best. The seminal fluids help ripen the cervix and provide an important birthing hormone, prostaglandin. This tip is very overlooked because there's an agreement in society that we need things like evening primrose oil or borage oil in our vagina, or perineal massage with fingers or vaginal dilator tools to get the lady parts ready for birth. Absolutely not! Get back to basics. Sex is the best way to prepare your cervix, vagina, and perineum for birth. What gets you pregnant, gets you unpregnant. Not to mention, it's fun and enjoyable, boosting one of the amazing birthing hormones, oxytocin, the hormone of love. Better get you some fun, enjoyable in at the end of pregnancy before you go without for weeks to months postpartum. I agree, tearing sounds horrible. There will be times it will be inevitable and nothing you can do to stop it from happening. Getting an episiotomy is even worse and very unnecessary in most cases because of the body's ability to stretch with this amazing relaxin hormone. An episiotomy is when a provider takes a pair of scissors and cuts the bottom of the vagina down to the anus to make the opening bigger. Tearing during natural childbirth is nothing compared to a cesarean. Vaginal tearing recovery is easier than a major abdominal surgery. If you are freaking out about tearing, I encourage you to enroll in my Train for Birth workshop. Train for Birth helps you prepare your body to birth your baby by helping the tissues of the body be responsive for a baby to go through your pelvis easier. Learn more about the necessary natural birth education you need to know to birth your baby with confidence at trainforbirth.com.